Rare often means precious, something you admire, something you want to possess, unless it is a disease. Then rare is scary. Rare is seldom treatable and curable. In case it is not affordable. That is the story of those living with spinal muscular atrophy, a rare disease that has treatment options. Treatment options that have given hope. But the cost of that hope is high as 17 crore rupees. In this episode of the Y-Axis, we look at children whose lives depend on their parents' ability to pool funds. Hello and welcome, you're watching Happiest Health. I'm Revati. Curtains with colors and cartoons. That's how you would imagine a pediatric ward to be. But at the Bengaluru Baptist Hospital's pediatric ward, it is not unusual to see relatives holding a toy and a BPAP machine in the same hand, hinting at the age of the child and the seriousness of the medical condition. Srinika is only 2 years old and is already immobile waist down. She has been diagnosed with spinal muscular atrophy. She cannot walk or play like other children. She is always in her parents' arms. They rushed here from their hometown in Chennai after the diagnosis 3 months ago.
அவங்களுக்கு காலில் அந்த மசில்ஸ் ஃபுல்லாக வீக்காக இருக்கிறதுனால அவங்க காலை கீழே ஊன முடியாது, அவங்களால முட்டி போடவோ எதுவும் நகரவே மாட்டாங்க. உட்கார வச்சா கொஞ்ச நேரம் உட்காந்துருப்பாங்க, அப்புறம் அப்படியே ஃப்ளிப்பாகி கீழே விழுந்துருவாங்க. நான் இது ரொம்ப நாளாக நோட்டீஸ் பண்ணிகிட்டு இருந்தோம். இது என்னன்னு தெரில. எல்லா டெஸ்ட் எடுக்கும்போது எல்லாமே நார்மலாக இருக்குன்னு தான் சொன்னாங்க. ஜெனட்டிக் டெஸ்ட் எடுக்கும்போது தான் இந்த மாதிரி பிரச்சனை இருக்குன்னு தெரிஞ்சுச்சு.
The visible signs of SMA often mirror a usual developmental delay, making timely diagnosis difficult. This leaves parents running from one specialist to another, losing crucial time.
People with rare diseases often struggle a lot because symptoms are vague. Many people think, what is this? This is not possible that you can get something like this. It takes a long time for them to get a diagnosis, and often because it's rare, they need multiple specialists. It takes them time to reach the right specialist to get a diagnosis. Till that time, they have to live with this disbelief. Once they get the diagnosis, they're told no treatment. Or they're told treatment, but very expensive. Crores, not lakhs.
SMA is a genetic disorder inherited from both parents. Most forms of SMA are caused by mutations of the SMN1 gene, resulting in insufficient production of SMN protein. SMN is essential to normal motor function. This disorder affects the motor neurons, nerve cells located in the spinal cord that control voluntary muscle movement. Because the muscles cannot respond to signals from the nerves, they atrophy, meaning they weaken and shrink from inactivity. A diagnosis of spinal muscular atrophy does not show the same level of severity. It varies depending on whether a child is diagnosed with type 0, 1, 2, 3 or 4. A type 0 may not survive beyond the womb. Type 1 shows signs well within the first 6 months and type 2 somewhere between 6 to 18 months.
Type 3 and type 4 is very difficult because they can be mistaken for many other disorders. So most of these children may not be diagnosed in their lifespan unless if they shown to proper neurologists and diagnose proper genetic testing. And even if they show neurologists, suspicion of these types are very difficult unless the physician is aware of this condition.
Unlike many other rare diseases, SMA now has treatment options available. The most recent and revolutionary of the lot is Zolgensma, a one-time gene therapy, costing approximately 17 crore rupees.
Most of the parents give up. One, because already to diagnose the child itself, they would have spent years and spent their fortunes, because even the diagnosis cost is very, very high. People lose hope. One, there is no treatment, and they don't see any quality of life with the patient, comorbidity, disability, and the lifelong healthcare challenges. They think that it is not possible for us. Obviously, it helps, affects your mental health. first your career, your family, your relation with your wife and spouses. Then what happens if you have other children? How do you take care of your normal child? Then more importantly, finance. How do you arrange finance? Because every time you go to a hospital for normal checkup, you have to do some series of tests that itself cost 25,000-30,000, and then if you have to repeat, if there is a hospitalization, if there is an ICU condition, it costs lakhs together.
When his son Janish was diagnosed with SMA type 1, Naveen and his family were devastated. It was a relief that Janish could be treated, but the cost of this gene therapy was beyond their imagination. Naveen, an insurance surveyor with a private firm, fought multiple battles. From managing hospital admissions for his son, who frequently fell sick, to court battles and running crowdfund to getting media attention for the case. To make matters worse, he was diagnosed during COVID after multiple visits to different hospitals.
He is not administered within 2 years, then there is no life for him like that. It was very horrible, this thing. Maximum he may live for 2.5 years like that, they told. It was very shocking and it was a worst experience in my life ever. With the whole family, I was very blank. Main thing, there was no neck control. Or else otherwise breathing and all, we have not observed. Because there is a fast breathing, because we thought it is, since he is a kid, there may be fast breathing and all. But exactly after 1 month of doctor visit, Dr. Ann has told that no, day by day you will be deteriorated, there will be a breathing issue, all sort of complication she had explained us earlier.
Janish's family managed to crowdfund Zolgensma. While his present condition may not be reversed, the progression has been arrested, they all hope. Janish could hope for a life expectancy like anybody else without SMA. Zolgensma as a one-time gene therapy must be administered before any significant damage in the body can take place. Ideally, as early as possible and well within the first 2 years. However, it is not the only treatment option. Risdiplam and Spinraza are the alternate options that families have to choose in the absence of access to Zolgensma. Although the cost seems lower, both are lifetime medications that turn out to be more expensive overall.
The Nusinersin, Spinraza, where treatment can be given any age group starting from birth to later adult age group. Also, the disadvantage of this treatment is medicine should be given to the spinal cord directly, backbone. So that should be given at least once in 4 months. It is a lifelong treatment, but whenever a child is getting very spinal deformity like scoliosis, that time we will find a lot of problem in injecting this medicine. And it is also very equally expensive. The third medicine, that is Risdiplam, that is currently approved by Indian government, that is available easily. And the only advantage of this medicine is it can be given through the mouth. So like any other syrup, it is a syrup tablet formulation is available. It can be given only once daily. This is approved by Indian government also. The disadvantage is it should be given again lifelong treatment. And the treatment cost wise, it is approximately per 10 kgs babies, it costs around 20 to 30 lakhs per year.
SMA affects 1 in 10,000 births. Some types may not be diagnosed at all or until later in life.
Unfortunately, what is happening is we're not aware. So we are saying we're a country which is like more than 1/6 of the world's population. We're saying we don't have these diseases. In our database, according to the government sources and things, we only have about 10,000 plus SMA. Our center, we are a very small center. We have 600 plus SMA. We are not such a big hospital. So if you take like that individual centers in the country, that's how we came up with the 10,000 figure. But we think if you use population and prediction and probabilities, there should be anywhere between 2 to 3 lakhs, anywhere at least above 1 lakh children or individuals with spinal muscular atrophy. So if people are aware, more people are aware of these rare diseases, and if they get diagnosed earlier, then a fracture may not be a fracture. A hip fracture is not a hip fracture alone. A younger person getting a fracture is not just a fracture. It might be SMA or DMD or something like that. So the more dramatic versions of the disease are the ones that present because they're incompatible with life early on. But the milder ones struggle with chronic aches and pains, not doing as well, getting teased, and not doing very well in life, whereas there are cures out there.
While we were at the Baptist Hospital interviewing Dr. Ann, she rushed out during our conversation to attend to a case in the ICU. It was a girl in her teens with LGMD, an SMA-like early onset neuromuscular disorder. A smart young girl who wanted to be a civil services officer. But by the time she was diagnosed and brought to this hospital, she was hanging by a thread. Within a few hours, while we were interviewing Janish and his family, we received a call. Her dream was cut short. She may have lived to fulfill her dream if she was diagnosed on time. A few kilometers from Janish's home, Aryan Murthy is living with SMA. He is currently on risdiplam. The costs pile up and the future looks uncertain as this is a daily medication. The parents continue crowdfunding for the one-time gene therapy. You need a closer look at him to confirm his diagnosis. He was diagnosed when he was 25 months old. Crucial time was lost in misdiagnosis. Like other children with SMA, Aryan is smart and intelligent. The condition does not affect the brain, and doctors say they are at par, if not more intelligent than other children. When his parents sat down to speak to us, Aryan noticed the collar mic on both. He permitted them to speak only when he was given a mic too. A fake mic, of course.
You can see he's SMA but type 2, and they said he is very strong for his type. So if he was just diagnosed when, in the newborn screening, okay, the amount is 16 crore, but we have comparatively a much longer time for the crowdfunding.
Nobody knew. I'd never heard of this disease until he was diagnosed with it. When you say genetic problems, usually refer to when you're marrying within your family circles. We are from two very different places, very different background. So we never suspected anything on a genetic front.
Normally I used to call other kids, my friends, other kids, they would come because he can't go out much, right? They will play around. He will be very happy to see them, but it's painful for the parents because he cannot join, right?
The struggle didn't end with their child's misdiagnosis as vitamin D deficiency and container baby syndrome. The parents also had to live through listening to blame and hurtful comments from those around.
The first thing which comes to our head was, let's die all together.
That was our first thought.
That was our first thought.
We actually thought
Because
there's no point.
Every people we call around in the family, 16 crore is too much, you cannot reach.
Have another baby.
Right? So
Love you too, baby. Love you too. Love you.
It was difficult.
One person, I will not say the name, she said, it's a defective piece, discard the defective piece and get a new one. Her exact words. So we've heard comments and we have to smile at that because we are asking for help.
If the medicine is not there at all, it's a whole different scenario again. But when the medicine is there, and as a parent, when you cannot provide to your child and seeing him slowly deteriorating or not improving at all is very, very painful. It's painful. When you see him smiling, it hurts you. When you see him crying, it hurts you. Basically, every day it hurts.
We had given up hope. But then,
we have a few very good friends.
They who gave us some courage.
Our solid
and
foundation,
they
give us a foundation.
Told giving up on life is easy. We need to fight for our son. If not us, who will fight for him? And that's when we started, really fighting for him. But I wouldn't say we are doing great, but we are doing our best.
Srinika's family continues to reach out to everyone they know. Janish is showing progress and Aryan is trying to stand on his own feet while his parents continue what seems like an endless wait.
Now one final question arises to the parent, whether my child can be normal. The plain answer as of now may or may not, because none of them, most of these medications are not treatment or treatable. It only betters your life. It's only compensates certain missing enzymes or protein, whatever. But whether the child can become right or a normal child is a very difficult question, because most of these drugs are very new drugs. We don't know what is the long term efficacy of the drug. That is one. Second, most important or a final question is, who after me? Okay, what happens to me when I am not there? Who will take care of my child when suddenly happens to me? Or if I get, old age patients, when you talk about late onset patients, where the child or a person who is 35, 40 years old gets diagnosed in myopathies, dystrophies, they cannot take care of them. When you are a child, mother takes care. After maybe 25, 30 kgs, there is an end. Their constant question is, who will take care when I am not there or when I get old?
மற்ற குழந்தைங்கள மாதிரி என் குழந்தையும் ஓடி ஆடி விளையாடணும், என் கூட லாஸ்ட் வரையும் இருக்கணுங்கிறது தான் மேம் எங்களோட ஆசை. லாஸ்ட் வரையும் என் குழந்தை கூட நான் சந்தோஷமாக இருக்கணுங்கிறதுக்காக மட்டும்தான் மேம் இவ்வளோ தூரம் நாங்கள் போராடிக்கிட்டே இருக்கோம்.
Many families like these have to bid their children goodbye or see them slowly deteriorate. Not because there is no hope. There is hope, but that hope is expensive.